Plastic surgery marketing. After people are aware that your plastic surgery practice exists and that you offer a solution to their problems, they're then going to enter the consideration phase. Basically, should I do this or not? And should I do it with you or not? There are marketing channels that you can leverage to help give you a leg up, and at the very least, get these patients to consider you over another option in their market. If you haven't seen the previous videos, I've linked to them in the description. Make sure you check those out before this one. But if you've already seen them, let's get into it. Consideration phase channel number 1, your Google business profile. After someone has become aware that your practice exists, it is highly likely that they're going to end up on your Google business profile. What is it that they're going to find when they get there? They're probably going to take a look at your reviews at some point. They're probably going to click over on the pictures. And the outside shot of the parking lot is probably not going to be enough to get them to consider you over someone else. Having pictures of the inside of your clinic, your staff, preferably some before and after showcasing your best work, all of this is going to increase the likelihood of someone considering you over another option. Marketing channel number 2 during the consideration phase, organic search. Now, what I mean by this is usually those reviews searches, meaning when someone performs a search like surgeon name plus reviews, they're not always going to go to the Google business profile. Some of them are going to look at your real self. Some of them are going to look at health grades. Others are going to go to Yelp. And this is going to vary a lot based on the market that you're in. So what we end up doing is perform a Google search and see what directories are ranking for your name plus reviews. Which brings me to channel number 3, your review acquisition strategy. I could do an entire video just on getting reviews, but here are a few tips. Ask each one of the patients during your follow-up visits if they're happy, if they would be open to leaving a review. Communicate how helpful they are. Send the follow-up email. There should be links to your Google business profile, as well as a platform where they can do it anonymously like Real Self. I'd also add that once you've really filled up the reviews on one platform, make sure you start sending them to the others. Going from 100 to 120 reviews on your Google business profile is not going to be as impactful as going from 0 to 20 on Yelp. Consideration channel number 4, the before and after gallery on your website. Each one of your procedure pages should have before and afters right below the hero section, or basically in a very prominent place that's going to be very hard to miss. But it's also important to have a link to a gallery in the navigation so that people can see your work. I'd also ask you to please invest in some good photography and some decent lighting. I'm sure that you would agree that some of these images are more compelling than others. So please put some thought in how you're showcasing your work. Consideration channel number 5, your Instagram. You'll find that lots of your past patients actually visited your Instagram and you may not have even known. It's usually the place that people go when they want to get kind of the behind the scenes view of what a doctor's office is like in a plastic surgery clinic. So please use your Instagram to educate, to entertain within good taste, and to let your prospective patients know who you are and what you're about. All right, so now someone's considered you and they're at the point of making a decision. There are marketing channels that are going to nudge them towards making a decision where you were the choice, and there are going to be cases where other plastic surgeons do a better job of it than you. In the next video, I'm going to walk you through marketing channels that you can use to bring more of these over the finish line.